Well, welcome to the spring webinar series at Advancing Employment. I am Doug Crandall, and I'm joined, as always, by Joseph Harrison and Dr. Tracy Rackensperger. We are celebrating our fifth spring doing webinars that we find people use both in training and just some self-paced learning. You can find all of those and more at the advancingemployment.com website, where you can join the community of practice. As I said, view the webinars and archive from several years. You can also get this white paper and others and some tips on economics and employment and disability. We're excited to have Dr. Rackensperger take us through this important piece of information related to mental health and job seekers and employees with intellectual and developmental disabilities during the pandemic and post-pandemic. It changed a lot of our lives in some ways, very good, and others things that we're still adjusting to and learning about. So without any further ado, I want to turn over to Tracy Rackensperger. Dr. Rackensperger will take us through a slide show here. Thank you all very, very much. Thank you, Tracy.
Welcome to my webinar on supporting the mental health of Georgia job seekers and employees with intellectual and developmental disabilities during the pandemic and post-pandemic. My name is Dr. Tracy Rackensperger. I am a public service faculty member at the Institute on Human Development and Disability, University of Georgia. I am the Resources and Outreach Manager for Advancing Employment, as well as the Project Director of a project called Preparing for Employment. The latter focuses on people with spinal cord injuries re-entering the workforce. I direct another project surrounding educating and connecting people about promoting competitive integrated employment over the practice of paying people subminimum wages. If you don't know me by now, I use augmentative communication to communicate. That's why you hear this artificial intelligence voice. Today, we are going to discuss conclusions from a white paper written by the speaker entitled Supporting the Mental Health of Georgia Job Seekers and Employees with Intellectual and Developmental Disabilities IHDD during the Pandemic and Post-Pandemic, a focus on encouraging good mental health through reintegration and continued integration of Georgians with IHDD into their communities. The COVID-19 pandemic has affected life for everyone. In this session, participants will learn the context for how individuals with IHDD have managed in terms of their employment, mental health, and community inclusion. During these challenging times, we will examine how we must do better to aid individuals to reintegrate and continue to integrate into their communities. Since competitive integrated employment is an essential part of being fully participatory in their communities, supporting the mental health of Georgia job seekers and employees with IHDD during the pandemic and post-pandemic must be conducted. We will discuss action plans with steps we must take to ensure the mental needs of Georgia job seekers and employees with IHDD during the pandemic and post-pandemic are met. If you make it through this whole webinar, we will tell you how to access the webinar. No cheating and fast forwarding. Prior to the COVID-19 pandemic, Georgians with intellectual and developmental disabilities IHDD already struggled to find, get, and keep competitive integrated employment opportunities. In 2018, only 13% of Georgians with IHDD were competitively employed in community settings. This means only 2,101 individuals were in competitive employment settings, while 16,671 were receiving supports in day programmatic settings, which includes sheltered subminimum wage and non-wage activities. While there is no published data available past 2018 about the number of Georgians with IHDD in competitive integrated employment settings, there are reports described later of job losses experienced by individuals with disabilities during the pandemic. March 2020 signaled an end to how people were living their lives. Although cases and deaths in Georgia are declining from the cases reported in 2020 and 2021, society is still dealing with the negative consequences of a prolonged pandemic. As the pandemic continues, individuals with IHDD continue to experience employment barriers, one of which is dealing with the psychological stresses of the prolonged pandemic. The mental health impacts of living through the COVID pandemic as individuals with IHDD have not been abundantly found and investigated. Intense and prolonged social isolation affects the psychological health of individuals in general. However, for individuals who experience oppression because of societal inequality, their psychological health is at increased risk. In aiding Georgians with IHDD in reconnecting and staying connected in their communities, there needs to be a systematic effort in supporting the mental health of Georgia job seekers and employees with IHDD during the pandemic and post-pandemic. Competitive integrated employment is an essential part towards the full inclusion of Georgians with IHDD within their communities. As such, we, as professionals in the disability services field, cannot ignore the psychological effects COVID-19 continues to have on job seekers and employed Georgians with IHDD. Individuals with IHDD often experience health issues from secondary health conditions and from the social circumstances in which they live. Comorbidities, inadequate opportunities to receive high-quality health care, and ecological considerations all influence individuals with IHDD being more at risk of developing chronic health ailments. Health disparities related to individuals with disabilities stem largely from historic and pervasive marginalization of this population. The advent of the COVID pandemic forced society to go back to old ways of completely segregating and socially isolating individuals with IHDD for the sake of their health. Justified at the time, backsliding to totally segregating and socially isolating individuals with IHDD may have significant impacts way beyond the end of the pandemic. These impacts will contribute to the psychological health of individuals with IHDD as they regain integration into their communities as well as competitively employed in their communities. For a population who has continuously struggled to become fully integrated and participatory within their communities, the COVID-19 pandemic curtailed strides Georgians with IHDD had made to achieve the goal of complete inclusion. Georgians with IHDD faced and continue to face decreased access to services allowing them to become meaningful parts of their communities. They faced and continue to face increased degrees of social isolation. As a result, increased degrees of social isolation have affected their well-being and mental health. Research studies reveal individuals with IHDD experienced and are experiencing significant challenges to their mental health and well-being related to the pandemic. These challenges include accessing factual information, interpreting information, navigating healthcare resources, contending with medical rationing fears, meeting public hygiene expectations, facing denial of community-based supports, relying on non-paid supports, and losing face-to-face interactions. The importance of addressing the mental health needs of Georgians with IHDD as seek out or continue with competitive integrated employment must be paramount. Individuals with IHDD have not had the same opportunities to use strategies to their peers without disabilities have had during the past 2 years in dealing with the sudden lack of in-person social connections. For example, the word Zoom has developed a whole other meaning besides going fast. Zooming now is the term usually associated with teleconferencing via a computer-based video application. However, for those with IHDD, accessing technology is often exigent. A large population of individuals with IHDD struggle with access to technology. Some individuals with IHDD need support and/or training to use technology effectively. With reductions of services, individuals with IHDD have even less opportunities to access technology and support to use that technology. Limited access technology and support to use that technology additionally restricts another strategy people without disabilities have used and continue to use during the pandemic. This strategy is telehealth telemedicine. The need for access to telehealth telemedicine has increased since the start of the COVID-19 pandemic. A part of the array of services offered through telehealth telemedicine are mental health supports. These mental health supports could help Georgians with IDD cope with the stresses of and social isolation caused by the pandemic. The potential for telehealth telemedicine services to aid individuals with IDD about mental health issues is great, but barriers and challenges to these services must be addressed robustly. Use of telehealth telemedicine by Georgians with IDD will ease the challenge of finding accessible transportation, especially in rural areas with no public transportation, and diminish the demand. With adherence to mask mandates and other public measures. However, expanding the use of telehealth telemedicine for Georgians with IDD must not be in lieu of improving access to in-person health service. Improving access to telehealth telemedicine must be done concurrently with improving access to telehealth telemedicine for Georgians with IDD. When the pandemic started, the state of Georgia and its counties implemented shutdowns of non-essential businesses. These shutdowns were months-long and mainly affected the service industry. Restaurants and retail outlets closed, leaving employees without paychecks or laid off. Unfortunately, most people with disabilities, especially those with IDD, work in low-paying, service industry jobs where teleworking is not an option. Therefore, many individuals with IDD lost their competitively paid jobs in the communities. Furthermore, only 30% of people with disabilities had jobs with high teleworking potential. People with disabilities who worked in essential jobs such as those in agriculture and mining, information, transportation, utilities and financial activities kept more jobs than people with disabilities in other industries. Individuals with disabilities in installation, service, and repair jobs reported the most loss of employment. As we reach closer to returning to how life was before the pandemic, there are still increased barriers for individuals with IDD stemming from COVID-19. These barriers existed before the pandemic and are currently worsened. One of these barriers relates to ensuring support for the mental health needs of Georgia job seekers and employees with IDD. Georgia job seekers and employees with IDD continue to face issues such as lack of supports and services to find, get, and keep competitive integrated employment. These supports and services include those aiding mental health. This lack of supports and services is significantly due to the national workforce crisis currently happening. But it also has to do with how we as professionals in the disability services field fundamentally aid and value Georgians with IDD. Better supporting the mental health of Georgia job seekers and employees with IDD during the pandemic and post-pandemic will require systematic changes in the method we provide services and supports to them. The following detail 2 broad action plans. These broad action plans have specific steps we have a duty to take to better supporting the mental health of Georgia job seekers and employees with IDD during the pandemic and post-pandemic. We need to stop needlessly isolating Georgians with IDD from their communities. As said earlier, the start of the pandemic required us to further segregate Georgians with IDD from their community peers. As a result, social isolation affected their mental health. As we slowly exit from the pandemic, it is imperative we do not continue this practice. We must take action steps to ensure we end the unnecessary exclusion of Georgians with IDD from partaking in all aspects of community life, including being competitively employed in settings with peers without disabilities. This will be significant in addressing the mental health of Georgians with IDD. These steps are based on plans related to 1. Supporting policies promoting community inclusion and equity, while ending policies upholding segregation and unfairness. And 2. Expanding quality community-based mental health care access for Georgians with IDD. Supporting policies promoting community inclusion and equity, while ending policies upholding segregation and unfairness. As was previously discussed, marginalization of individuals with IDD significantly affects their mental health. Continued policies promoting or, at the very least, financially incentivizing segregating Georgians with IDD must stop. Fragmented access to general health and prophylactic care, stereotypes held by society and the medical community, and marginalization contribute to the higher rates of mental health conditions experienced by individuals with IHDD. In 2023, we still have a disability service system performing services inconsistent with the spirits of the Americans with Disabilities Act, the Olmstead Decision, the Department of Justice Settlement Agreement, and the Home and Community-Based Services HCBS Settings Rule. In terms of supporting the mental health of Georgia job seekers and employees with IHDD during the pandemic and post-pandemic, we need to phase out the practice of paying individuals subminimum wages and be financially incentivize services and supports enabling Georgians with IHDD access to competitive integrated employment opportunities. Phasing out the practice of paying individuals subminimum wages requires legislative action to change policy. In 1938, the Fair Labor Standards Act FLSA created a special exemption authorizing employers to pay wages significantly lower than the minimum wage to workers with disabilities. Progressive at the time, these wage provisions were created to encourage the employment of veterans with disabilities in a manufacturing-centered economy. Nowadays, paying significantly lower than the minimum wage to workers with disabilities is increasingly inequitable and challenging to civil rights. Supporting the phasing out the practice of paying individuals subminimum wages starts with one understanding the effects of subminimum wages has had on the mental health of individuals with IHDD. 2. Building a coalition encouraging the phasing out the practice of paying individuals subminimum wages, and 3. Actively endorsing an employment-first agenda. Understanding the effects of subminimum wages has had on the mental health of individuals with IHDD is possible through actively listening to individuals with IHDD who are or have been subjected to being paid subminimum wages. For example, James Meadars, who is an individual with IHDD, talks about his feelings when receiving his first paycheck as an employee making subminimum wages in a YouTube clip. We must not only review the information available online but reach out to Georgians with IHDD to hear of their experiences. Building a coalition encouraging the phasing out the practice of paying individuals subminimum wages needs to happen now. We need to build and join the coalition to be in favor of a policy that focuses on phasing out the practice of subminimum wages specifically in the state of Georgia. I am currently supporting this endeavor through a contract with the Georgia Council on Developmental Disabilities (GCDD). Through this contract, a coalition was created to strategize ways to eliminate 14C and shift focus on competitive integrated employment. The Coalition Against Unfair Salary for Employment cause was developed. Cause believes all Georgians with disabilities can have meaningful lives within their local communities. Cause believes this is achieved when individuals are supported to use their gifts and talents to live, work, and play alongside their peers without disabilities. Cause values full community inclusion, which encompasses individualized support, personal choice, and access to competitive integrated employment and income-generating activities. Thus, Cause is the coalition that is meaningfully engaged in organizing at the grassroots and state levels to advocate for needed regulatory, legislative, and policy changes to ensure the phased ending of 14C in Georgia. This upcoming contract year, IHDD will request funding from GCDD to continue supporting Cause. The coalition that is meaningfully engaged in organizing at the grassroots and state levels to advocate for needed regulatory, legislative, and policy changes to ensure the phased ending of 14C in Georgia. We request funding for continuing to create and distribute online material that educates people regarding 14C, its origins, the changes in our society making 14C obsolete and counter to civil rights. We also request funding to support the writing of a white paper, a retreat, a dedicated Cause webpage, and the continuance of quarterly Cause and bi-monthly Sterling Committee meetings. Actively endorsing an employment-first agenda must occur by following through with implementation of activities making competitive integrated employment the first choice in providing daily supports and services to Georgians with IHDD. This requires us to continue in working towards the expected outcomes of the Employment First Council. The expected outcomes surround making employment as the first and preferred option for individuals with disabilities receiving public services who choose careers as a path to independence. Financially incentivized services and support enabling Georgians with IHDD access to competitive integrated employment opportunities means a total restructure of provider rates about offering day supports in sheltered workshop settings versus services allowing Georgians with IHDD to work for competitive wages alongside individuals without disabilities. We need to address the issue by applying for federal demonstration grants, 2 using the federal aid provided, if passed, in the Transformation to Competitive Integrated Employment Act, and 3 exercising cross-agency funding and services to facilitate competitive integrated employment. Applying for federal demonstration grants aids us in setting up how innovative models and new ways of thinking expand competitive integrated employment. These grants are often put forth by the Administration on Community Living ACL, U.S. Department of Labor USDOL, and U.S.S. Department of Education USDOL. These entities want states to show innovative concepts about supporting competitive integrated employment. Utilizing the federal aid provided, if passed, in the Transformation to Competitive Integrated Employment Act will allow Georgia employment service providers to get the aid needed for transformation of their services. If the Transformation to Competitive Integrated Employment Act passes, this federal bill will provide grants and technical aid towards transitioning employers to a business model that pays at least minimum wage to workers with disabilities. The Act will aid providers in continuing to provide services and supports to workers with disabilities, particularly to those with the most significant disabilities. GVRA did receive SWICE funding that will address a couple things we are discussing. Exercising cross-agency funding and services to facilitate competitive integrated employment will expand access to work opportunities. However, this requires agencies collaborating to achieve individuals' employment goals. Often though, agencies run in their own spheres and do not coordinate with each other. Successful competitive integrated employment outcomes depend on creative cross-agency funding and services. Creating teams of representatives from the Department of Behavioral Health and Developmental Disabilities (Ph.D), Georgia Vocational Rehabilitation Agency (GVRA), and entities included under the Workforce Innovation and Opportunity Act (WIOA). Expanding quality community-based mental health care access for Georgians with IHDD. Access to quality community-based mental health care for Georgians with IHDD is complicated by barriers. Since the pandemic started, the barriers in accessing mental health services for those with IHDD have been worsened. Supporting the mental health of Georgians with IHDD through reintegration and continued integration. Supporting the mental health of Georgians with IHDD through reintegration and continued integration of them into their communities calls for us to end barriers to receiving mental health services. These services must exist in local communities, not in segregated facilities just for individuals with IHDD. The latter choice contradicts the point of community reintegration and continued integration. Therefore, we must ensure access to services available to those without disabilities are accessible and at the same quality for Georgians with IHDD. To begin addressing access, we must assess the specific needs of Georgia job seekers and employees with IHDD that include solution recommendations and provide training to both mental health professionals and pre-service medical students about serving individuals with IHDD. Assessing the specific needs of Georgia job seekers and employees with IHDD that include solution recommendations will serve to guide us in our plan to expand quality community-based mental health care access. As stated previously, there are mental health issues experienced by individuals with IHDD since the start of the pandemic were explained. We need to investigate further how the pandemic has affected specifically Georgia job seekers and employees with IHDD. To accomplish this goal, we must conduct a statewide needs assessment which investigates the experiences of Georgians with IHDD and families regarding pandemic-related mental health challenges and service access. 2 documents employment support and mental health providers' challenges in serving those with IHDD, and 3 records the workable solutions to challenges faced by all stakeholders. Investigating the experiences of Georgians with IHDD and families about pandemic-related mental health challenges and service access must be carried out. This can be achieved through conducting surveys, focus groups, and personal interviews with Georgians with IHDD and their families about pandemic-related mental health challenges and service access barriers. By doing these tasks, we can focus on supporting mental health as it relates to employment. We can take note of the specific barriers affecting Georgians with IHDD finding, getting, and keeping competitive integrated employment. Documenting employment support and mental health providers' challenges in serving those with IHDD is also important in authenticating the complexities of supporting the mental health of Georgia job seekers and employees with IHDD. This can be achieved through conducting surveys, focus groups, and personal interviews with employment support and mental health providers about barriers in serving those with IHDD pandemic-related mental health challenges. We can take note of the specific barriers affecting providers' abilities in aiding Georgians with IHDD with their competitive integrated employment goals. Recording the workable solutions to challenges faced by all stakeholders requires us not to just settle for the information gathered through the needs assessment. Creating space for contemplating solutions motivates us to act. We do not need another document without a method to address needs. We can build on the knowledge already gained through this as well as comprehension gotten through our needs assessment to document solutions. Providing training to both mental health professionals and pre-service medical students about serving individuals with IHDD is critical in expanding the availability of high-quality community-based mental health services for Georgians with IHDD. Studies demonstrate often healthcare professionals have distorted views about individuals with IHDD. Professionals tend to make healthcare decisions based on these perspectives, which do not reflect the actual needs of individuals with disabilities. The lack of knowledge mental health professionals has about individuals with IHDD is a significant barrier to accessing quality community-based mental health care for Georgians with IHDD. Subsequently, medical programs variably teach about working with individuals who have IHDD. Nationally, only 61% of medical school deans surveyed felt students were competent to work with individuals with disabilities. Studies show medical students report little understanding and/or misconceptions about individuals with IHDD. Therefore, we need to establish partnerships with Georgia's medical health care college and university programs to identify and implement methods to educate future mental health professionals about individuals with IHDD, to collaborate with state medical and healthcare organizations to deliver education to existing mental health professionals, and recreate opportunities for Georgians with IHDD and their families to meaningfully contribute to the development and implementation of this education. Establishing partnerships with Georgia's medical healthcare college and university programs to find and implement methods to educate future mental health professionals about individuals with IHDD is a critical step to address access issues. There are 5 major medical schools in Georgia as well as several other schools offering healthcare-related programs. These programs enroll thousands of students each year. Developing ways to reach these students to educate them about individuals with IHDD will expand the number of community-based professionals who can provide quality mental health supports to this population. Agencies who serve Georgians with IHDD need to meet with school administrators and curriculum developers to plan to integrate IHDD-focused content in their programs. Collaborating with state medical and healthcare organizations to deliver education to existing mental health professionals has the same functions as the preceding step, only with targeting current mental health professionals. In Georgia, there are approximately 160 professionals specializing in mental health care per 100,000 population. Using U.S. Census Bureau population projections, in July 2021, there were an estimated 10,799,566 residents of Georgia. Therefore, it is likely Georgia has approximately 17,280 mental health professionals. We need to collaborate with such organizations such as Licensed Professional Counselors Association of Georgia, Georgia Psychological Association, and National Association on Mental Illness NAMI Georgia chapter to create and distribute educational material for existing professionals in the field. We need to break away from the separation existing between IDD services and community-based mental health providers. Creating opportunities for Georgians with IDD and their families to meaningfully contribute to the development and implementation of this education is essential. Those who have IDD and their families are in the best positions to find what they need from current and future mental health professionals about access and communication. They should be at the forefront of the curriculum. Supporting the mental health of Georgia job seekers and employees with IDD during the pandemic and post-pandemic has complexity. We focused on supporting the mental health of this population through reintegration and continued integration of them into their communities. The COVID-19 pandemic has caused major disruptions of life activities for everyone. However, for Georgians with IDD, the pandemic only increased and added to barriers they experienced years prior to the detection of the virus. As a result, greater social isolation caused and still is generating amplified need to provide community-based supports to Georgians with IDD. We have detailed the research existing about how COVID has affected the mental health and employment of those with IDD as well as their decreased access to community services. Competitive integrated employment is a significant part of being an active participant in the community. To ensure the mental health of Georgians with IDD, we must support them living and working in safe, fully inclusive communities. The action plans outlined in this presentation are a comprehensive way to build a system support the mental health of job seekers and employees with IDD during the pandemic and post-pandemic. So where can you access the white paper? To access the white paper, visit the Advancing Employment website. For more information, please email me. Thank you for listening.
Dr. Rackensperger, thank you for, I was glued to this. I love all of that you brought out. And I think it's so timely because people are moving on, as you say. And I don't know if you remember, Dr. Rackensperger, when the pandemic really hit, there were several memes and well, I shouldn't say several, there are probably tens of thousands or more, but particularly it was a meme related to folks with the labels of IHDD, and I think the phrasing was a photo of somebody and it said, "Now you know how I feel isolated." And that really struck me as a powerful way for just, ordinary citizens to understand the kind of segregation, isolation, congregation that so many folks have to endure. So I just love this. Folks, you can go to the advancingemployment.com website or email Dr. Rackensperger here. Want to thank you so much, Tracy. This was so illuminating and so timely. Thank you.